Everyone, and welcome to the University of Nebraska Medical Center, UNMC. I am the program coordinator for endocrinology, and I will give you a brief overview of our fellowship program. To begin with, I will be telling you a little bit about UNMC. UNMC campus, as you can see on the screen, is extremely expansive. It is in the heart of Omaha, Nebraska. And we are a Joint Commission certification in inpatient diabetes. We have about 718 hospital beds. We're a level 1 trauma center. We are a transplant center, including heart, lung, kidney, liver, pancreas, and small bowel. And we are well known across Nebraska as we are one of the main sources of healthcare for rural, urban, and suburban areas. All right, so today what I am going to go over, as you can see on the overview, is we're going to introduce you to the program leadership, our faculty, give you some of our program goals, a brief overview of our fellowship and our education, and then end with what is life like here in Omaha, Nebraska. All right, I'm going to begin with our program leadership. So our program leadership makes up our program director, our associate program director, and our division chief. So beginning on the left is our program director, who is Dr. Amy Neumeister, who focuses on general endocrinology and is our clinical medical educator, and is also our EPIC super user. In the middle, we have Dr. Armis. She is our Associate Program Director, whose focus is on osteoporosis, calcium metabolic disorders, and vitamin D deficiency. And finally, on our right is Dr. D'Souza, who is our Division Chief, and he focuses on cardiovascular disease in diabetes and endothelial dysfunction in diabetes. This is our core faculty. We are constantly growing our faculty to better help our Nebraska population. And our core faculty is going to involve our educators, our core faculty, our VA faculty. Our Veterans Hospital is just right down the street from UNMC, so we are heavily involved and partnered with the VA. We also have our endo-oncologists and our hospitalists as part of our faculty members. So we want to talk about some of those program goals. So ultimately, what do we here at UNMC want you to get out of the program? And obviously, we want you to be clinically proficient in all of those areas of endocrinology and have clinical exposure, including multiple endocrine subspecialties. We want to enhance your research skills, including developing your own research project, participating in investigator-initiated trials, data interpretation, literature review, and presentations. And ultimately, what we really want is we want you to have that real-world experience to prepare you for autonomous practice. So in your endocrinology fellowship, you will have extensive inpatient and outpatient clinical training, including that you'll have the ability to perform your thyroid ultrasound, DEXA interpretation, CGMs, all of that. You'll be able to be involved in research. We have a great research team here at UNMC and in our endocrinology department. So you will be mentored within our division and be able to collaborate with outside departments in research and in research projects, including things like quality improvement projects. And then we also obviously are going to mentor you in your growth as an endocrinologist in both the medical side and your professional development business side of endocrinology, whether that is you wanting to stay in academics after you graduate, or if you want to go into private practice. We are hoping to give you a full, well-rounded view of endocrinology so that you can make the best decision for yourself. Okay, so I'm going to go into a little bit more on our fellowship. So what will your life look like when you become a fellow here at UNMC in the endocrinology division? And we work off of a modular schedule with 2-week block rotation. So every 2 weeks, you're going into a new rotation. So ultimately within your time here, that means you are going to have experience in the UNMC inpatient, our VA inpatients, or our veterans. Then you also will have outpatient, both at the VA and UNMC. You will have opportunities with our thyroid rotation and our endo oncologist. And in your first year, you're really focused on your basics of endocrinology while also giving you some exposure to things like pituitary, bone. We have bone rotations like that, but making sure that you have your foundation pretty solid. And then in your second year, you get a little bit more freedom to look at what you want to specialize in. And so you're going to be able to have a little bit more freedom to say, I want to be in bone, or I want to do adrenal, or I want to be more in the with the endo oncologist, or more with the hospitalist. So it gets to become your choice in some ways of what you want to focus on, what you want your future to look like. And all while that is happening, weaved within those rotations are going to be your research opportunities. So you have research opportunities both at the VA and at UNMC, including quality improvement projects. In your second year, we also get to expand our exposure into rotations such as like pediatric endocrinology. You will get to also work with outside departments such as bariatrics, just to make sure that you are getting the full, well-rounded endocrinologist experience at UNMC. Now here is a brief overview of our outpatient clinic opportunities. So these are some of the things that you can see within our clinics and at UNMC and at the VA. So very obviously we're going to have our general endocrine, our insulin pumps, but you can also find lots of opportunities for things like pituitary. We have our neuroendocrine tumor clinic. We have our thyroid biopsies. We have our metabolic bone disease clinics. We have transplant, telemedicine, transgender medicine, reproductive endocrine. We have all these opportunities for you to become a well-rounded endocrinologist. One of the things that you will directly be involved with is your continuity clinic. So you will have a half day every other week at UNMC for your non-diabetes endocrine continuity. And then you also will have a half day at our VA where we will deal with our diabetes continuity clinic. So you get a continuity clinic every week, one at the UNMC campus and one at the VA campus. And it just helps you expose you to, again, more opportunities of endocrinology, and then also allows you to have your own patients, meet your own patients, kind of create that relationship over the 2 years that you are here. So if we go into our educational conferences and what that looks like, that is weaved within your rotations. We are going to have a core lecture series for our first years and second years that include all of our faculty, educating you on different endocrinology disorders or things that you need to be aware of. We also have our clinical conferences that you guys will present at along with other residents and med students. We have a board review that helps prepare you for your boards. We do research conferences, we do journal clubs, we have an endocrine tumor board, and we have our grand rounds where we often have outside speakers come and speak on expertise topics. All right, I'm going to talk to you a little bit about the city that you could possibly be living in, Omaha, Nebraska. So Omaha metro area is about 1 million people. The Omaha city itself is probably about 500,000, with this suburban area making up the other half of that. We are a very fast growing city in the Midwest. We are a 4-season state, so we do get summer, fall, winter, and spring. We are pretty well known for low cost of living. We have good public schools. We're relatively a safe city. And there's always stuff to do in Omaha. So Omaha's a hidden gem of a city. It's a really fast-growing city. We are expanding all the time. Um, we are a really good city for if you have kids and want to raise kids. People love to move to Omaha to raise their kids in a safe environment, and also it tends to be lower cost. But Omaha is also really cool for if you're a young professional and you want to meet people and go out. Omaha is a very, I'd say, extroverted city. We always like to do things uh, around the city and in the state in general. We are pretty well known for being friendly. We have the things that we have to do. We're a big sports state, so obviously we have our Huskers at University of Nebraska Lincoln. Uh, we also have a couple of professional teams here in Omaha, including our Supernovas, which is our volleyball team, and our LOVB, which is another professional volleyball team. We also have had the swim trials here. So if you're into sports, we have the swim trials. We have Union Omaha, which is our semi-professional soccer team, which has been one of the top soccer teams in semi-professional soccer teams in the league in the United States. But there's always stuff going on in Nebraska. We have a lot of, we're big foodies, so we always are uh, hyping up our local food places. We always have festivals going on. We have a good music scene. UNMC is really cool in the fact that we are right in the heart of Blackstone, and Blackstone has a lot of uh, breweries and places to gather and meet with people. And there's kind of always something for everyone in Nebraska. So if you have any questions more about our program, feel free to ask during the interviews, but you can also always ask the program coordinator anything about the program or about Omaha in general that you need answered. Thank you so much for listening into this. I hope you have a great interview, and hopefully we'll see you very soon.